For over 100 years, medicine thought that brain cells never regenerate, but the picture changed. Neurons do grow, especially in two regions of the brain, in the hippocampus, which manages memories and emotions, and in the olfactory bulb, which is responsible for smell. In real life, when you see one person who learns easily, remembers easily, and another who forgets everything, you can say that the person with better memory likely has better neurogenesis. On the other hand, any person can have depression, but if one person recovers with several weeks, while other remains depressed for 12 months, it means that the faster recovering person likely has better neurogenesis. We need brain cell renewal to learn new information, to adapt stress, to recover from emotional trauma, and delay brain aging. This brain cell growth is called neurogenesis. When neurogenesis drops, depression, anxiety, and memory loss and cognitive decline appear. On the other hand, smell is the most direct emotional sense in the human brain. Smell is the only sense that goes directly to the emotional centers without passing through logic first. That's why a single smell can instantly trigger fear, comfort, sadness, safety, or nostalgia before you even understand why. That's why smell center neurons also grow. Neurogenesis in the olfactory bulb is essential for emotional updating. When new neurons grow there, the brain can separate past emotional memories from the present moment. When this process is suppressed, smells can lock a person into old trauma. This is why people with post-traumatic stress disorder often react violently to specific smells. And this is why neurodegenerative disorders like Alzheimer's disease often begin with loss of smell years before memory loss appears. The smell center is one of the first areas where neurogenesis fails. That's why we will talk about how to improve brain cell growth effectively. The first and most important thing we can do to grow neurons is physical movement, especially aerobic exercise. This is not motivational talk. This is pure neurobiology. When you move your body, you trigger the release of brain-derived neurotrophic factor, which is the main growth factor for the brain cells. Without it, new neurons die before they mature. In real life, this is why people who walk, run, swim, or cycle think faster, remember better, and recover from stress easier than sedentary people. At the same time, the risk of depression drops 30 to 40%, and the risk of dementia drops around 30%. In physically active people, regular movement leads to an increased hippocampal volume by around 2% yearly, which is massive for adult brain. Best exercise regimen for neurogenesis is moderate to intense aerobic exercise, regular, not extreme, not rare, but rhythmic and repeated. The strongest effect in studies is seen with brisk walking, slow running, cycling, and swimming, performed 40 to 60 minutes per session, 4 to 5 times per week. The second most important thing we can do to grow neurons is deep, regular sleep. During slow wave sleep and rapid eye movement sleep, the brain physically rebuilds itself. Large studies show that chronic sleep deprivation suppresses neurogenesis around 60%, and even 1 week of poor sleep already reduced memory formation about 40%. On the other hand, restoring normal sleep for several weeks reverses this suppression in most people. This is why depression, anxiety, and burnout almost always begin with sleep disruption, and why recovery always starts with sleep normalization. The mechanism is direct. Sleep lowers cortisol, restores neurotransmitter balance, strengthens synaptic connections, and allows new neurons to integrate into memory circuits. The third most important thing we can do to grow neurons is constant learning and exposure to new information. When you learn something new and difficult, the brain is focused to create new neuronal connections, and at the same time, it rescues newborn neurons from programmed death. Without learning, mainly newly born neurons simply disappear. With learning, they integrate and stay in real life. This is why two people of same age can look completely different mentally. One keeps learning, adapting, and stays sharp for decades, and other lives on routine and mentally ages much faster. Studies show that complex learning increases survival of newborn neurons almost 50%, improves memory performance in 70% of people, and significantly delays age-related cognitive decline. This is also why people who learn new languages, new professions, new skills have lower risk of dementia, reduced around 40%. Fourth most important thing we can do for our neurons is emotional safety and recovery from chronic stress. The most destructive stress for neurogenesis is long-term uncontrolled stress, especially emotional trauma, chronic anxiety, toxic relationships, burnout, financial insecurity, caregiving overload, and post-traumatic stress disorder. These forms of stress keep cortisol permanently elevated, and cortisol directly blocks the birth of new neurons and kills immature neurons in the hippocampus. In real life, this is why two people can exercise the same, eat the same, and live in the same city, but one becomes mentally stronger while other becomes exhausted, anxious, and forgetful. Studies show that chronic uncontrolled stress suppresses neurogenesis by 70%, while removal, stress source, or effective stress regulation restores neurogenesis in about 70% of people with 4 months. The fifth most important thing we can do for our neurons is omega-3 fatty acid intake, especially DHA. This is not about random fish oil. This is about structural fat. Physically builds neurons, neuronal membranes. DHA is main fat inside brain cell. Without it, neurons are born fragile and die early. With it, neuron membranes become flexible, signal transmission improves, and survival rate rise. Studies show DHA increase hippocampal volume and regeneration, and neurogenesis is improved around 35%, and improves memory speed and emotional stability around 70% of people. The most effective regimen is 1 to 2 grams of combined EPA and DHA for at least 12 to 16 weeks. The sixth most important thing we can do to grow neurons is intermittent caloric restriction, not starvation, but controlled metabolic stress. Mild caloric restriction activates cellular cleaning systems and energy efficiency genes that directly stimulate neurogenesis. Studies show that intermittent fasting increases hippocampal neuron formation around 30% and improves memory performance in 60% of people. The most effective regimen is 16 hours of fasting and 8 hours of eating 3 to 5 days per week with stable protein intake. The mechanism is precise. Fasting activates adenosine monophosphate activated protein kinase, increases brain-derived neurotrophic factor, improves insulin sensitivity, and shifts brain into regeneration mode. Constant overeating blocks this process completely. Seventh most important thing we can do to grow neurons is sunlight exposure in the first half of the day. This is not about only vitamin D. Morning light directly activates serotonin-melatonin cycle, which controls neurogenesis timing. Studies show that people with regular morning light exposure have high hippocampal activity and better memory consolidation, while seasonal light deprivation suppresses neurogenesis and increases depression risk by around 40%. The most effective regimen is 20 minutes of outdoor daylight exposure between sunrise and 11 a.m. at least 5 days per week. And eighth most important thing we can do for our brain is cold exposure in mild controlled doses. Cold activates noradrenaline and mitochondrial efficiency, which boosts neuroplasticity signaling. Studies show that controlled cold exposure increases growth signaling by around 20% and improves stress resilience in most users. And the most effective regimen is cold showers at 10 to 15 degrees Celsius for 30 to 90 seconds, 3 to 5 times per week, or brief cold exposure after exercise. The mechanism is activation of noradrenaline, improved blood flow, and stimulate brain-derived neurotrophic factor. Extreme cold exposure suppresses neurogenesis, but mild cold stimulates it. And the ninth important factor is antidepressant-mediated neurogenesis when natural recovery is blocked. This is not but only mood control. This is about restoring physical neuron birth in hippocampus. Selective serotonin reuptake inhibitors directly stimulate neurogenesis signaling. Studies show that depression, 60 to 70% of clinical recovery, depends on restored neurogenesis, not just neurotransmitter changes. The effective regimen is daily low to moderate therapeutic dose for at least 6 to 8 weeks, because neurons need time to burn, mature, and connect. This is why antidepressants never work instantly. They work only when neurons physically grow. And the 10th important thing we can do is stable social bonding with emotional meaning and not causal interaction, not forced communication, but stable, emotionally meaningful connections. Studies show that chronic social isolation suppresses hippocampal neurogenesis around 50%, while emotionally supportive relationships restores it in about 60% of people within a month. This mechanism is direct social bonding, increases oxytocin, stabilizes dopamine, reduces cortisol, and restores growing signaling in the hippocampus. The most effective pattern is daily emotionally meaningful interaction with at least one safe person, not large groups.